I have a very good friend of mine. For the purpose of this video, let's just call him Pakwesi. So Pakwesi is a tall, handsome young man, very well built, and let me just say he meets all the criteria that every young man in Ghana is expected to meet. So for a very long time now, Pakwesi has been very, very particular about his appearance. He's so fixated about his looks, his body shape, his body size, and from time to time, he keeps comparing himself to how his colleagues looks. Even when they tell him he looks good, he does not believe it. He is extremely into self-grooming. He's constantly picking his skin, especially when he sees one pimple on his skin. Pakwesi is offended. Recently, he's been going on and on about how he doesn't like the way his nose looks, how he wants to do something about it, and he constantly needs validation. So this dawned on me, could this be BDD? Hi guys, you're welcome to today's first episode of Mental Health Discussion with me, and today we are going to talk about Body Dysmorphic Disorder, also known as BDD. So, the narration I gave earlier concerning Pakwesi are some of the symptoms that a person who's going through BDD could be portraying or could be going through or experiencing, and people around him or her would notice. So, what then is BDD? BDD is a mental health condition where an individual is very obsessed about flaws on his appearance, his or her appearance. Believe me, sometimes these flaws may not be noticeable to people around him. In most cases, people do not even notice. But they are preoccupied, they are worried, they are extremely obsessed about how they look or how a particular part of their body looks. And this interferes with their emotions, their mood, their day-to-day activities. And they become very anxious. They also become very ashamed of their appearance. They feel guilty. And sometimes it leads to depression. Are there causes of body dysmorphic disorders? Yes. Research has it that genetic factors or family dynamics play a very vital role when it comes to this mental health condition. Also, the environment at large is a contributing factor. Sometimes the things that we are exposed to, the beauty standards, the contents, the projections on how a person should look goes a long way. In other cases too, our own self-esteem contributes to BDD. If the way we look is modified or is actually conditioned by our values, then BDD could set in. With that said, you need a certified clinical psychologist to diagnose you before you can start treatment of BDD. These psychologists could take you through cognitive behavioral therapy, introduce you to antidepressants or SSRIs. These are all going to help you to boost your confidence or, manage your mental health condition. There is no cure. It can only be managed. Now, as family and friends, what can we do to support our friends who are victims of this mental health condition? 1, we should accept their feelings because they are not exaggerating. 2, we should give them listening ears. We should be good listeners. 3, we should support them during their therapy sessions and also encourage them to seek therapy. I'm sure a lot of people might be wondering, could this be the result of the numerous surgical operations that is liposuction and BBLs that we are seeing in recent times? To some extent, it could be. That is, if a person becomes surgically addicted or is addicted to surgery, every now and then the person wants to alter a certain part of their body, then you could say that person is suffering from BDD. But if it's just a one-time body modification, just to look good, just to, you're not happy with your nose, so you might go for rhinoplasty, yes, that is okay. That is a personal decision, so that is fine. With that said, guys, I hope you have learned something and you will continue to take care of your mental health. Thank you very much for joining me, and see you in my next video. Bye.